Dear friends, hello. I greet you again from another gynecomastia surgery. We have completed our gynecomastia surgery. I do this surgery using a technique I developed just for myself. To concentrate on this area, please avoid making any cuts of the nipple and instead create a vertical incision of 8 to 9 millimeters from below, starting with the fat tissues in this area. We remove the fat tissue in this area using classic liposuction or laser liposuction methods. Following that, we proceed to extract the breast tissue, which includes the milk glands situated beneath the nipple in this region, using this same opening. Dear friends, I will attempt to shed some light on an important point that might be confusing, drawing from my experiences. Regardless of the liposuction method we used, whether it's called classic liposuction, laser liposuction, which I really like, the vaser technique, or laser methods, I don't think it's possible to completely or partially remove the mammary tissue, which consists of the milk glands located in this area, by melting it down and extracting it. We must somehow remove the residual breast tissue that remains after performing liposuction in this area. Some doctors cut beneath the nipple to remove this breast tissue. This method is acceptable. Some doctors are trying to avoid taking it out. They mention melting it with either laser or vaser. On the other hand, I extract the milk glands from this area through the incision made for liposuction without cutting the nipple. I remove them mechanically. In other words, this means that through the incision made for liposuction, you are simultaneously freeing yourself from both your excess fat and your breast glands. Certainly at this point, I might have needed to express this at the outset. Gynecomastia is, in any event, 99% mix, beloved friends. What does it imply when we say mix? It contains both fatty tissue and breast tissue. The proportions of these can vary, but 99% of the time it is this mix. In other words, we must extract both fat tissue and breast tissue from this location. The distinctive aspect of our technique lies solely in this cut. We are removing both fat and milk glands through this incision. In a single procedure, you will eliminate both fat and breast tissue, leaving just the outline of your pectoral muscle. You end up with just that. Should you have any questions, we are here to help you around the clock 7 days a week. My team and I are dedicated to assisting you. Stay tuned. See you soon.